Have you considered managed care for your workers' compensation claims? Wondering if you should? If you have a claims adjuster, do you even need an MCO? What do they actually do? The short answer is, more than you may realize. Workers' compensation claims can be very complex, especially if it involves a serious injury. Let's walk through a typical claim to see what managed care could mean for you. When someone gets hurt at work, their employer contacts our intake team to report the injury. If it's not an emergency, but the employee still needs medical care, the operator will direct them to a provider that is experienced with workers' compensation. Once the operator assigns a nurse case manager, the first report of injury is filed with the state and a copy is sent to the adjuster and employer. The claim is officially open. Before the operator ends the call, the patient receives digital versions of their prescription and claimant cards. Most workers head to the pharmacy immediately after being treated, so they need their pharmacy card before it comes in the mail. Our digital pharmacy card gives them immediate access to coverage details, in-network pricing, and a list of local network pharmacies. This also gives the nurse case manager the ability to provide clinical oversight and approval. Usually, within an hour of receiving the referral, the nurse case manager calls to introduce herself and to educate the injured worker on the claims process. She gathers all the details surrounding the accident while they're still fresh and documents the exact cause. Accident details are vital to determining causality and whether the claim is compensable. It also helps with potential litigation and guards against fraud. The claimant's medical history is logged, and any underlying issues that could impact treatment or slow recovery are noted. If there are any previous injuries, secondary employment, or potential witnesses, she'll document that too. Once the interview is complete, she will follow up on any treatment the worker may have received and schedule an appointment with a specialist best suited for his injury. If additional treatment is necessary, the nurse case manager will collaborate with the treating provider to manage their care. She'll request the treatment plan and compare it against established guidelines and internal protocols. She'll ensure any treatment given is medically necessary and related to the injury claimed. The amount, frequency, and duration of all treatment is reviewed by the nurse case manager as well and is subject to her approval. If the claimant needs time to recover, the nurse case manager will implement a return-to-work plan with the treating physician immediately. Getting employees back to work quickly and safely is everyone's goal. So, the return-to-work plan is discussed at the very first appointment, and again, at every follow-up, until the employee returns to full duty. A key strategy to the return-to-work plan is determining the worker's physical abilities and any need for special accommodations. The nurse case manager will provide the physician with the job description and have her evaluate the worker's physical capacity. With this information, she can help the employer develop a modified assignment whenever possible. When a worker is healthy enough to return to work, the nurse case manager will continue to guide the patient, monitor treatment, and pre-approve all services until the patient has achieved maximum medical improvement and the claim has been closed. So, what does a managed care organization actually do? They advocate for the patient and facilitate better outcomes. They help to contain medical costs and guard against fraud. They educate employers and guide workers through the claims process. And here at First MCO, we do it all within an end-to-end, user-friendly platform.